Itinerant cataract surgery campaign in Brazil. Logistics and outcomes. The eyes are the human body's window, which decode the light reflected by the objects and allow us to perceive the environment around us. The eyes are the human body's window, which decode the light reflected by the objects and allow us to perceive the environment around us. It's through them that we can see the beautiful scenery in the world and all kinds of work, from the most complex to the simplest. This is Adeltina Ribeiro da Silva. She dwells at Lagoa Grande, a humble neighborhood at Poções, 280 miles from Salvador, Bahia, Brazil. At 82 years old and retired, she lives with her son and is devoted to housework. She is responsible for keeping the small house in order. At least, she used to be. About 6 months ago, Mrs. Adeltina started to notice that she couldn't see very well, and things that used to be simple for her, like sweeping the floor and doing the dishes, started to get harder as days went by.
Eu faço as coisas, mas é a pulso, que é o jeito, né? Tem dia que eu não posso sair, não. Eu choro e fico nervosa, fico muito nervosa. Eu varro a casa, quando eu olho, que eu volto de lá e de longe eu vou, até vejo o lixo para trás que eu deixei. Que eu não vejo, vai ficar.
Mrs. Adeltina is part of a group that grows in exponential proportion every year in Brazil, the elderly. According to the Brazilian Institute of Geography and Statistics, 19 million of Brazilians are over 60 years old, and estimations are that this number will rise up to 28 million in 2020. A group of people that grows larger yearly, and as it grows, becomes more and more susceptible to the same disease as Mrs. Adeltina faces, the cataract. According to the World Health Organization, WHO, in 2011, around 285 million of people had some kind of visual impairment. Among those, 39 million were blind. 82% of the blind are aged over 50. The main cause is cataract, embracing 39% of the visually impaired, which corresponds to more than 111 million people all over the world. In the state of Bahia, where the total population is over 14 million people, estimations are that around 190,000 people are visually impaired by cataract. Many of them are dwellers of the countryside, who abandoned their farming or housing activities due to visual incapacity. People like Mr. Dionísio, he has always worked in farming. For many years, he lived from the production of his small property in Bahia's countryside. By observing this landscape, nobody imagines that here, corn, beans, tomatoes were grown. But the dry land reflects another problem beyond dryness. It has been 2 years since Mr. Dionísio last plowed the land and farmed crops or vegetables. He's not able to do it anymore. His vision is not as good as it used to be.
Roçar não já roço mais. Eu não luto mais com o negócio de roçar. Agora limpar eu limpo. Quando eu olho para trás eu deixei mato atrás. Aí fica tudo assim, sem... Se eu fazer direito, né? Que a gente da roça é cuidadoso para fazer tudo bem feitinho, né? Aí eu fico até com vergonha de eu mesmo.
Thinking of giving back the independence of hardworking people like Mr. Dionísio and Mrs. Adeltina, Bahia carried out, through a public-private partnership, the biggest project for cataract treatment ever performed in Brazil. The target were low-income people, 60 or older, indexed at Unified Health System, known as SUS, responsible for 80% of the medical assistance in Brazil. The population receives excellent eye care and gets modern technique cataract surgery completely free of charge. The results are exciting. In only one stage of the project, that lasts 7 days, around 5,000 people were examined and 2,500 cataract surgeries performed. In order to make the project possible, a large group of people is mobilized during the whole process. Along the period, nearly 100 professionals from many careers are recruited, and among them, one of the best ophthalmology team in Brazil. In order to afford the project, a huge structure is settled in the city, with reception, triage, tests, preparations, clinic, and a very large operating room, with a capacity of up to 6 simultaneous surgeries. The OR center is mounted in a completely isolated and sterilized area. The structure follows the policies of the National Agency of Health Surveillance, known as Anvisa. It was at this space that Mrs. Adeltina and Mr. Dionisio had the opportunity of getting to see again. Mrs. Adeltina was one of the first to arrive at the building where the hospital was assembled. With documents in hand, she was promptly attended by the pre-treatment team and forwarded to the triage sector, where along with the other patients, she registered at the program. Within less than 10 minutes, Mrs. Adeltina received the eye drops for pupil dilatation, and then she went to check the ocular pressure and make refraction tests that precede the ophthalmologic appointment.
Quando o paciente dá entrada no consultório, a gente vai avaliar, né, com o exame de lâmpada de fenda, que é este aparelho, a gente vai avaliar se tem catarata, qual o grau da catarata, examina o fundo de olho, para avaliar as patologias da retina, do nervo óptico, né, a gente avalia a pressão da medida ocular também. Em cima disso, em seguida, a gente já faz o diagnóstico se tem ou não catarata, né, já faz o exame de refração. Aqueles pacientes que não precisam operar, a gente emite a receita de óculos. Nos pacientes que têm indicação cirúrgica para catarata, a gente encaminha eles para orientação cirúrgica, que é o nosso próximo setor adiante, onde o paciente tem a sua cirurgia marcada e agendada para ser realizada aqui mesmo nessa etapa do projeto.
The doctors have in hands all the features and equipments to provide the best service to the population. In cases of very advanced cataracts, when it's not possible to evaluate the posterior segment of the eye, ocular ultrasound is performed. Nobody is undiagnosed, and more complex cases are referred to a tertiary referral center. Once the need for the surgery is detected, the patients are taken to surgical guidance sector in order to schedule their operation. Mrs. Adeltina's surgery, for example, was booked 2 days after her appointment with the doctor. She has diabetes, and she was quite nervous with the possibility of not getting the operation because of the disease.
Se eu não ficar pior, porque estão dizendo, ai, tu vai fazer a cirurgia, tem diabetes, vai ficar pior. Eu fico chorando com medo disso.
At the day of the surgery, Mrs. Adeltina arrived early and was promptly taken to the sector of preoperative care. Once over there, her blood pressure and capillary glycemia were tested. She calmly got the confirmation for the surgery once her tests were within the pattern. The procedure takes about 10 minutes and it's done in ultimate generation equipment, under topical anesthesia and foldable intraocular lens implant. The medical team has an anesthesiologist, professional who assures the basic life support.
A cirurgia moderna da catarata é feita através de microincisão, então não precisa dar ponto, não precisa de oclusão ou tampão após a cirurgia. Nós fazemos com anestesia tópica à base de colírios e esse aparelho facoemulsificador consegue fragmentar em pequenos pedacinhos a catarata e aspirá-la. Depois a gente implanta a lente intraocular.
At the end of the operation, Mrs. Adeltina was the sight of excitement. Now, able to see, she was taken to the post-operative room, where Mr. Dionisio already was. They received the kit with protection glass and eye drop, booked the review of the surgery, and celebrated like children the possibility to see the world with new eyes.
Graças a Deus fui bem recuperado, demorou pouquinho, mas foi formidável, graças meu bom Deus, graças a Deus. Eu agradeço a Deus primeiramente, depois esse pessoal maravilhoso, graças meu bom Deus, meu Pai.
Estou enxergando melhor, estou sentindo bem, muito bem. E eu não sei nem o que eu posso dizer, eu agradeço tanto a vocês. Agradeço essa... Oh, meu Deus, que eu não sei nem explicar a alegria que eu estou.
In order to avoid more and more people going blind because of cataract, the World Health Organization defined the goal of 3,000 cataract surgeries per million of inhabitants every year until 2020, and this fraction defines the cataract surgery rate. In Brazil, during 2006 and 2007, a study showed that cataract surgery rates were 1,842 and 2,051 surgeries per million of inhabitants, reaching 60.4% and 68.3% of the target respectively. To reach the ideal target today, estimations are that Brazil should perform 720,000 cataract surgeries every year. In Bahia, the project by itself performed over 96,000 cataract surgeries in the last 3 years, reinforcing the objectives of the project Vision 2020, which aims to eliminate the main causes of avoidable blindness by the year of 2020. Analyzing the international experience, sharing learned lessons, and applying better practice are the directives of WHO for prevention of blindness. Public-private partnerships and cooperative actions have shown to be a very effective formula to fight the problem.
Crescer! Crescer!